Good. I just wanted to go over this in just a little bit of detail. So importantly, starting to immunize our over 50-year-old population really does allow us to start to encompass all people in West Virginia that are responsible in the age categories for the deaths that we've seen. Again, the governor's read people that are younger, which is an important part I want to come back to here in just a second. But identifying those people, but still maintaining our discipline of immunizing our oldest West Virginians who have not been immunized first, and then continue to move down the list. But we really ask everybody to go ahead and register if you're in that prioritization group so that we know that you're there. And then, consistent with what the Centers for Disease Control recommends, and the governor making the commitment to our educational sector, we have included now all pre-K through 12 from the primary schools, and then for higher ed, all of the teachers and service personnel in higher ed that meet those criteria, both from 40 to 50 years old, pre-K through 12 and higher ed, will be included in that group. And that will be reassuring, I think, for many people who are back in the classroom. As we've said, our epidemiology tells us the classroom is really safe to be in, but immunizing our older teachers and service personnel, and now being able to include our 40 to 50-year-old group, does provide an additional layer of protection for them in the classroom. And we're very happy to be able to do that. And all this is really made possible by the fact that we're seeing more vaccine. And as the governor said, we also are very sensitive to trying to make sure for our younger people, people less than 50 years old, who have severe illness or have a problem set that puts them at higher risk of being hospitalized or getting severely ill or dying from COVID-19, that group we want to include as well at every age. And as the governor said, we are limited because the emergency use authorization from the Food and Drug Administration for the Pfizer vaccine based on the clinical trial is 16 and above. And for the Moderna vaccine and for the Johnson & Johnson vaccine is 18 and above. And what we've targeted with this first group of priority diagnoses are individuals with Down syndrome, individuals who have intellectual and developmental disabilities, and if they require chronic caregivers for those West Virginia citizens and their caregivers. Also to incorporate West Virginians who've had congenital or acquired injuries or illnesses, for instance, neurological disorders that have created the inability for them to walk normally, or sometimes even breathe normally, or brain injuries or strokes or other types of problems that keep them from being able to independently take care of themselves. So we want to make sure that they are eligible for vaccination and their caregivers. And then citizens in West Virginia that have received a solid organ or bone marrow transplant. Those West Virginians who are obese, and this is now medically obese, and we talk about this body mass index over 35, which for most people don't mean anything, but if you put it into normal terms, that means for a person who's 5 feet tall, a weight that's about 180 pounds or above, or for somebody 6 feet tall, a weight that's about 260 pounds or above. And this is important because these are people at much higher risk for hospitalizations and death from COVID-19. And then people who have sickle cell anemia, people that have cystic fibrosis, and then for women that are pregnant, because pregnancy is a risk area for us, and we want to make sure with the approval and the consent of the obstetric and gynecology experts that are taking care of you if you are pregnant, that we want to make sure that a vaccine is available to you. And we know that there are other diagnoses that people are concerned about, but I think with this group of priorities to add to what we've already done, and the fact we've seen such extraordinary outcomes from the strategy we've taken, this is really a move forward. And as we continue to get more vaccine, of course, we want to immunize every West Virginian that's eligible. But as we are able to open up these prioritization areas for people, we want to be very disciplined and pick those areas that have the highest level of evidence to suggest that we're going to save lives, reduce hospitalizations, and help West Virginia return to normal. So thank you very much.